Here we are, birds singing once again, a quiet afternoon. An important topic, possibly, unless you are, don't die, unless you, live forever. Now, what the COVID-19 pandemic has highlighted is the importance of a publicly funded universal health care system. If it's one thing it has done, it has highlighted how important such a system is. It also has highlighted the deficiency of our current system. And there are many deficiencies, but let's not forget that our public health system was under pressure before of the pandemic, almost 2 years ago, under extraordinary pressures. And these pressures have occurred because of the privatisation and corporatisation agenda which has been pursued by successive governments since the Whitlam-led Labor government in the 1970s. Now, it's important to remember that universal access to healthcare has not always been a right in this country. It was a right which was won after a long, very long series of protest and political campaigns and trade union activities. And it wasn't until 1974 that the Commonwealth government, under the much maligned Whitlam-led Labor government, introduced a universal healthcare system which entitled every person living on this continent and the islands around this continent the ability to access care free of charge, irrespective of their social situation, irrespective of the amount of money in their pockets, irrespective of whether they were earning $3 billion a year or earning nothing. Now, interestingly, I'm old enough to remember that particular debate and the fact that the Australian Medical Association, every other medical association in this country, including the pharmaceutical sector, was dead against the introduction of a universal healthcare system because they equated it with socialism. Really pathetic. But the Whitlam-led Labor government had a lot of difficulty getting that legislation through Parliament, but eventually got the legislation through Parliament. And more importantly, it set up a system that, despite the efforts of successive governments to dilute and privatise it, it continues to exist. It's not a perfect system, far from it. The COVID-19 pandemic has highlighted a number of very important deficiencies in the public health sector. And that ranges from the social and preventative aspect of public health care to the provision of services for non-emergency cases, to provision of paramedical services and services which are not covered by Medicare. But at the end of the day, the fact that we have a relatively low mortality rate in this country as far as COVID-19 is concerned is not just a matter of vaccination or a matter of social distancing or a matter of wearing masks or a matter of contact tracing. It's because we have a reasonably funded public health sector which can provide emergency care, including ventilation and intensive care treatment to people who require it. So let's look at the deficiencies of the system before COVID-19, and let's look at the way that we can actually improve the system, because, as I said at the beginning of this little dissertation, unless you intend to live forever and unless you don't suffer from the aspects of ageing, the fact is every human being in this country and around the planet will have health care issues. Some of the healthcare issues are a matter of class, some are a matter of education, some are a matter of access to vaccination and pharmaceuticals, some it's a matter of access to diagnostic procedures. But at the end of the day, we will all require that care. And interestingly, in this country, the private health sector is basically a mechanism via which healthcare providers make profits by cherry-picking the easy cases and leaving the multiple trauma, the carcinomas, the major cardiac issues, the major stroke issues to the public sector. So the private sector, which relies on you paying for that service through medical insurance, private health insurance, which is subsidised by the Commonwealth government to the tune of $6 billion a year, or putting your hand in your pocket to subsidise the services provided by the private healthcare sector. So let's start from the beginning. I think the most important aspect of public health is social and preventative medicine. Now, some of the greatest gains which were made as far as mortality rates were concerned, especially amongst children, was the introduction of sewerage system in this country. Very simple thing, removing human waste. By removing human waste, you markedly decreased cholera, typhoid, gastroenteritis. At the beginning of the 20th century, or late in the 19th century, almost 2 in 5 children died of preventable diseases due to the fact that our waste was not adequately looked after. So obviously, social preventative medicine is very important, because when you talk about an obesity epidemic, diabetes 2 epidemic, an epidemic based on heart disease, colonic cancer, and the list goes on and on. Prevention or early diagnosis is critical to decreasing the pressure on the public health sector. It's essential. It is essential. The problem is, over the last 40 years, both at the state level and federal level and the council level, social and preventative medicine has been starved of funds. Less than 2 cents in every dollar which goes to the public healthcare system is used for social and preventative medicine, whether it's education, whether it's vaccination, whether it's access to pharmaceuticals, and the list goes on and on. Secondly, in this country we do not have a pandemic or disaster centre, a national pandemic disaster centre which can coordinate responses at the state and federal level. And if there's one thing that's been highlighted, apart from the fact of the importance of a universally accessible, publicly funded healthcare system, is the lack of coordination between states and federal governments regarding dealing with the COVID-19 pandemic, the piecemeal approach, and the fact there is no such thing as a pandemic disaster centre, with regional headquarters in Canberra and branches in every state and territory in this country. So we need to move down that path as far as social and preventative medicine is concerned. The other issue is that we have privatised the Commonwealth Serum Laboratories, sold the shares for about $2.75, now they're worth I think over $130 each. The Keating-led Labor government privatised the Commonwealth Serum Laboratory, which was initially set up by a Labor government in 1911 to provide vaccinations for Australians at an affordable cost. So when it came to the COVID-19 pandemic, not only didn't we have the manufacturing capacity publicly to manufacture COVID-19 vaccinations under licence, we didn't even have the coordinated capacity to develop our own vaccines to deal with COVID-19. So we need the introduction of a new Australian Serum Laboratory, publicly owned, which is involved in researching to provide medications and to provide vaccinations. At the same time, we also need a publicly funded pharmaceutical industry. Currently, we are hostages to private pharmaceutical corporations who set prices, and if they develop something like a new medication or vaccination, can set whatever that price they like because of intellectual property rights for the next 2 decades. That's 20 years. They have the monopoly on producing those pharmaceuticals or those vaccinations. So these are 3 simple things that we can add to the current public health sector, which is basically responds to crisis. It doesn't actually try to prevent crisis or to prevent pandemics and epidemics. So the first thing is the setting up or the establishment of a central health disaster pandemic coordinating body in Canberra. The establishment of peripheral bodies in every state and territory so that we can coordinate responses to pandemics or epidemics, things like obesity, type 2 diabetes, cardiovascular disease, colonic cancer, breast cancer, not the piecemeal approach which is now taken. Thirdly, we need the establishment of a new serum laboratory, an Australian serum laboratory, which is publicly owned, which can manufacture vaccines as well as develop new vaccines. And fourthly, we need a publicly owned pharmaceutical production centre, which can actually produce pharmaceuticals at a reasonable price so we're not hostages to large corporations. And the next thing we need to look at is access to the public health system. Because although emergency access is very good, access in non-emergency situations is very poor. So, although you may have private health insurance, you may not actually be able to afford the excess which you need to pay to a private sector. So we need to see funds go into the public health sector to expand its ability to deal with the increasing number of medical issues which need hospitalisation and which need operations because of a rapidly ageing population. We don't have the same healthcare issues as we had 100 years ago. We now have healthcare issues to a significant degree which are related to increasingly ageing population and all the problems which come with increasing age, like senility, dementia, cardiovascular disease, coronary heart disease, carcinomas, and the list goes on and on. Because the older the human organism becomes, the more susceptible it is to disease. And we have not really understood that we need to expand the public hospital sector, especially the geriatric sector, to incorporate these increasing number of people who need health and pharmaceutical intervention, not only to survive but to have a reasonable quality of life. So public funds need to be poured into the public health system, and they need to be poured into the public health system from the federal level and the state level, because the federal government has the power to levy taxation. It is at the centre of the ability of this country to provide adequate public health resources through a little bit more innovative taxation measures. Measures like a 1% turnover stock market tax, which could raise up to $30 to $40 billion a year, which could be used for the public hospital sector. A 1% turnover tax on businesses and corporations with a turnover of more than $2 million per year. That could raise another $100 to $140 billion per year. Extraordinary amounts of money in a taxation system that only raises around $550 to $600 billion per year. And the fact is that what makes this country different to many countries is the fact that we have access to a public health system which is accessible to anybody. That is a difference. This is something that doesn't occur in most of the world. If you don't have the money to buy the pharmaceuticals necessary, you die, even if it's a few dollars. If you don't have the money to access vaccination programs, you die. If you don't have the money to access a surgeon, you die. It's very simple. Simple concept. Your survival depends on the amount of income in your pocket at that particular point in time, with the amount of money your family and friends can raise in order to keep you alive. But in Australia, because of a universality of Medicare and because of the public health system, which is federally and state funded, we can not only provide care in emergencies, we can, if we wanted to, we could provide care for all people on this continent, the islands surrounding this continent. We could use the latest pharmaceuticals, not have to wait and wait and wait for acceptance into the pharmaceutical benefits scheme for certain pharmaceuticals which are effective to be used because of their cost. We could decrease the cost, as I said before, by having our own pharmacy production, our own Australian Serum Laboratory, which is publicly owned, publicly funded. Public interest before corporate interest is all about that. It's all about putting the interest of the many before the interests of the few. It's about putting the interests of the individual before the interests of corporations. Public interest before corporate interest. It's about putting the interests of the public before the interests of corporations, and the list goes on and on. Access to healthcare, universal access to healthcare, is a central plank of our political program. It is a central plank. It is one of the most important planks, as well as public education, public ownership of resources in this country, mineral resources, and the list goes on and on. But access to healthcare is a central plank, because over the last 40 years, many activists like myself in the health field have been fighting a rearguard action to protect the universality of our healthcare system, to expand it so that it can actually deal with the problems that are thrown up at us because of an ageing population, to deal with the problems which affluence causes, problems like obesity, type 2 diabetes, increased cardiovascular disease, and the list goes on and on. But in order to do that, we need a major transformation of the public health sector. We need to include social preventative medicine in the public health sector. We need to include an Australian Serum Laboratory, pharmaceutical manufacturing arm, a health disaster council, headquarters in Canberra with regional branches in every state and territory. We face many problems as we go forward as a nation, or even as a people. Problems thrown at us by the climate emergency which we're all facing, which we are very hesitant to tackle because of the so-called economic costs. Problems of recurring pandemics which will occur because of increasing temperatures. Problems because of the increasing gap between the rich and the poor. The fact that most Australians are neither rich nor poor, but are indebted up to their neck. Although we may think that we are capable of dealing with any healthcare needs for ourselves and our family, the fact is we're not. To give you a simple example, a businessman from New South Wales found himself in the United States last year and developed COVID-19. He spent 5 months in hospital and eventually died. His family has been sent a bill of $11 million. It doesn't matter how rich you are, unless there's a universal publicly funded healthcare system which incorporates prevention, which incorporates pharmaceuticals, which incorporates the extension of the public health sector to deal with the elective tsunami that we are now facing, elective surgery tsunami and healthcare tsunami we are now facing. Things will go back to what they were like in the early 20th century and the 19th century, that you only deserve the best healthcare that money can buy. If you want that to occur, fine. If you want to gamble your future, your children's future, your family's future, your friends and your relatives' future, that somehow they won't get sick, and they will. We all get sick. Well, fine. But if you want something better, you want something more stable, you want that security of knowing that you have access to a first-class healthcare system, free of charge, then I suggest you strongly campaign to defend and extend Medicare. Strongly think about joining public interest before corporate interests, where a universal health system which looks after the people's needs is a very central plank of our political and philosophical platform. Thank you.